Namaskar. We would like to welcome you all on behalf of Independent Research Ethics Society, AYUSH Samriddhi International Webinar Series at milestone of 2326. Thank you very much for your overwhelming, due to which we have been able to touch this milestone within 5 years. Today, we are starting a new series, interactive series, with our respected Gurudev, Ayur Dr. Avtar Singh Ji. He is Ayurveda Ratna, recognized by Government of UK and Parliamentary Association, renowned herbal medicinal practitioner of London, founder Siddha Ayurveda Clinic, Academy and Research Center in London, UK. He has more than 50 years experience and means, sorry, again, I would not like to quote his
No.
age.
More than 50, you can say, यार थोड़ा सा हंसने भी दिया करो मेरे को, आपको दर्शन करके.
So we are really grateful to Avtar Singh sir that he has accepted our proposal to start this interactive series. And I would like to welcome all our pillars. Dr. Nishant Shukla ji is with us, and all the audience and YouTube viewers also. So without wasting much time, I would like to request Dr. Avtar Singh sir for his kind blessing, and then I and Nishant ji will be interacting. Dr. Nishant ji, am I audible? Namaskar.
Namaskar.
Today we are starting interactive series. Some disturbance is there from your side. Nishant ji, some noise is there from your side.
Yes, sir. Boli.
So we will be interacting with Dr. Avtar sir.
Okay.
But some noise is behind you. Please stop that noise. So I would like to request Dr. Avtar sir for his valuable wordings, because recently World Liver Day was celebrated for creating awareness, and today we took the same topic on liver disorders, because due to bad habits, due to wrong lifestyle, our liver is really sacrificed daily. So thank you, Avtar sir. Please guide us.
Thank you very much, Dr. Pawan Kumar ji and Nishant Shukla ji. I see the girl we call she's very young, and Aishwarya Singh Thakur. They're from the UK now. They're in the Delhi, and she's also on there. And Dr. Mr. Abdul Wahid, Haji Abdul Wahid is there. Some other one, Bastan is there, and Aishwarya also done so many Zoom meetings, and she's in the UK. They have the very big company. They're working with them, and Dr. Honzi is the director of that company. Maybe I told them maybe they come on that one and tell about the experience of the what kind of the. They also send me the one patient of the liver cancer, hepatitis B, and everything. We're going on that treatment's doing very well. So liver is in our body's biggest organ who control whole body. Liver, if liver come in the problem, then all the nutrition, pure blood and everything, toxins go into the spread in our all organs, become very big problem. Liver also is very, very strong. Liver can heal self. They have the ability to heal self. But when we ignore the symptoms, most problem, why nowadays people getting very big psoriasis, hepatitis. There are 5 types of hepatitis: A, B, C, D. Mostly common hepatitis B and C, but actually uh, 5 types of hepatitis recognized nowadays. Everyone and every kind of therapy, they're doing work on that one. Allopathy also doing very good work on that one. They find the what kind of the vaccine. New problem for the liver is coming from last 50, 60 years. What is the reason we have to find out? Also, we have to find out how can we solve this problem. We want to educate our clients, our audience, our listeners. There are 3 missions I have, that one, to tell the world what we can do through the Ayurveda. In Ayurveda, they have very good ability, very good medicines in Ayurveda. How can we make our liver workable again when they infected? Doesn't matter on the psoriasis, cancers, we can save them if patient come on time to the Ayurveda. Most problem is nowadays when the people get some problem of the liver, they start doing their own treatment. Lot of people are giving lectures on the Zoom meetings everywhere. They go to the Google, they're not going to the proper physician who know the job. And they asking the relatives, asking the friends, when the symptoms come for the what is the problem, how can you, the symptom is very important. If you know the symptom, then you can easily can cure the first stage, very easy to cure. When they go second, third, is not very difficult. We call asadhya, not asadhya. But when they go past the third stage, then they call asadhya. In the allopathy, they're calling autoimmune diseases. Who delays that one to liver problem? Patient self, they're delaying the time. They anytime they see that they have the symptom of the, if the liver have any problem, like first through the, according to Ayurveda, the appetite's going down. Patient become very quickly tired. They can't sleep well. And other very big problem when they coming, urine becoming dark. Sometimes itchy skin, nausea, vomiting. This is not the first stage. This is also difficult with the liver. First stage, not big sign come, but patient think nothing wrong. Maybe little bit tiredness, maybe little bit I can't eat properly. These kind of symptoms they ignoring. Should not be ignored, because without liver, blood can't take any nutritions, vitamins, and blood become problem. All the problem the start when we ignore. This is the first we have to educate our listener. When these kind of symptoms come, swelling in the legs, urine dark, or sometimes very dark. If the little dark, sometimes it's okay. But when they come continuously dark in the whole day, that means your liver is in the big trouble. And this kind of the problem, when anybody find, they straightway go to any physician. Doesn't matter where they go. First thing, they have to do the full blood check. they should do full blood check, blood count. They check everything, liver and kidney functions. Because there's not only liver damage with the second stage, they can damage your kidney too. Metabolism become very slow, and other problem later on can become the problem. Once liver go to the stage of psoriasis, then it's take time to cure with the Ayurveda, I can say. It's not mean they're not curable. As I say before, if you come in the stage first or second, you very quickly Ayurveda can cure that one. Because I'm an Ayurveda practitioner, Ayurveda physician. I know the Ayurveda. I'm an Ayurveda researcher. I treated so many liver psoriasis, liver cancers, and last stage where the hospital said, this is 90% your liver is gone. And some cases, they said, need to be transplant the liver. Those stage of the cancer also with the Ayurveda should be curable. If patients have the listen to properly, follow the diet properly, patients should keep the patients that time. Problem is everybody is want to very quickly, it's not quickly cured, but curable. I done the cases. That cases the people, I done the liver, nearly 6, 7 patient, which one the hospital say they can't do anything, but they are still alive. But I salute to them. They follow the Ayurveda properly. With the Ayurveda, you can do it. There's so many physicians, they know the how to treat the in Ayurveda, very big chapters for the cure the liver problems. So many Ayurveda medications in our rishis made that one in our Ayurveda system. And if those medication or those medicine made properly, they work. Maybe we have to some modify according to this time, because nowadays different kind of the liver problem is coming. Those kind of problem 100 years ago, 50 years ago was not there. Many is infections like hepatitis A, B, C, D. They are all is the some is STD infection inside. They're getting from other people. Some is a new type of viruses, and some is side effects of the medications. Where the side effects came from, we have to be very careful. Sometime I have to no shy to say this one. Some herbs also can give the problems. If you take wrongly, it's not cured properly, then they come the problem. When you buy the medication, don't buy your own on the counter. Go to the physician. Physicians always have some responsibility. They are very careful, Ayurveda practitioners. They know if they can't cure, their name become bad. I respect every physician of Ayurveda. They have the ability to give you the good result. Ayurveda is maybe little slower than other therapy, but they cure properly without any side effects. But if you self-diagnosed, self-medication make it, medication herbs have the quantity of to use. If you're using overdose that same herbs, they can give you the problem. Many people don't know. Sometimes they take it or take this one for the liver. Those medication maybe for the liver is good for the liver. If you take the overdose, they also give you the problem. Nowadays, everybody, if they got the problem, anybody, they first start self-diagnose system. Going to the Google, going to the so many, many time I call them media remedy doctors. Everybody is telling there. If you ask them what your qualification, where you learn, they don't know. Maybe some people are doing good job, but not everybody. But make sure when you're taking any treatment for liver, don't do these kind of mistakes. Better you find in your area the good Ayurveda practitioner, go there. I told many times, I can tell again. I'm said so many times, take your blood. First you do the blood check, full blood check. Nowadays, very easy. Everywhere is available. And you can very easily find what kind of problem in your liver. Give to the physician, take your report and give to the physician, any physician, doesn't matter. And don't tell him what your problem have. If he tell you the 50% of your problem, when he see your blood report and pulse check, okay, if he ask you this, if you find out 50%, he can do your treatment. You need the physician who know the job. Then you definitely get the result. This is all is curable. I treated hepatitis B, hepatitis C, hepatitis E. Well, need to be physician like what I told you. This is the good way to find the good physician. When you find the good physician, you can get good health. He can bring back you the normal life. Follow his instructions. He can make good medication for you. Good physician always keep the good medications. They know their reputation. And then after that one, this kind of problem should be cured. Liver, don't ignore the liver symptoms. Liver is not the only one organ. Liver is linked with every organ of the body. Once they go to the 70-80% damage, then it's very difficult to cure it. Then life-threatening time is come. But if you find the good physician in Ayurveda, like I told you, they can cure it. In Ayurveda, they have to be very good. They have many good medications, very skilled. I know so many in India. Ayurveda practitioner, they're doing great job for liver cancers, liver cirrhosis, hepatitis. These are the most problem in the liver. Jaundices, they can cure it. Ayurveda is great therapy, great medications, and especially who making their own medication, that's more important. That time, stage 3rd, 4th, you need the who do the medication, custom-made medication. That time, so many other organs of the patient become the problem. If these kind of you do it, then no problem. This one is curable. And if anybody need the question, like in this program, our program is specially designed to we give the answer to our public, our audience. They can ask the questions, and nearly half an hour we definitely give them. If anybody asks the question to me, or I can, what is my experience, I try to give my answer to them. And some of the, I think we have to question answer time to give them. This is what I say. If they want anything more asked to me, I definitely try my best.
Sir, I would like to ask one question.
Oh, thank you.
Why these cases of liver cirrhosis, liver cancers are increasing in last 3 decades? Previously, we were also living. That means somewhere technology is also involved as a factor, causative factor. Radiation from microwave, radiation from towers, radiation from mobile. Everywhere we are surrounded by radiations. So whether any radiation factor or technology factor is aggravating these cirrhosis, cancers, or serious cases. Otherwise, we were living right from 5,000 years or more than that. No cancer was there in maximum cases.
Oh, it's mean you are more antique than me, Anna.
So what are those causative factors? Please
I
guide
say,
so we can
I
avoid.
say, I say you are more antique than me. Okay. Thank you very much. And what you said, that's well said. Is I think why this one comes when pesticides come. Number one. Secondly, when actually pollution comes through the petrol. Nearly, I know that when 50, 60 years ago, the petrol, the pollution in everywhere, that is the biggest problem in my research. And also the so many other problems. Before that one, you know, me know, people was one other biggest problem I shared definitely that one. People start eating each other food. In one plate, they eating 3 people, 2 people. They sharing their spoons, sharing their each. That is also problem. With the saliva, with the touch, with the blood, with so many other things, okay? They also come to the liver problem. And biggest problem nowadays, alcohol. Alcohol, everybody is without alcohol, there is no any party. And the alcohol they're eating, plus the food they're eating, the all pesticide food, alcohol they're eating, they're doing the like competitions. The free serving alcohol, they want to drink, we want to drink maximum for 1 month in one party. And alcohol are also biggest damage for the liver. And people, when they go to the party, you also going somewhere, many where I seen people like oh my God, they don't think what they think, okay, drink it. This is the also biggest problem. Before that one, people also drink the alcohol 40, 50 years ago, but their diet was very good. Nowadays, from the so many food they we serving in the party, they have the lot the food from the tin foods. Tin food have the lot of sulfur inside, some other chemicals. We all eating that one. That's also damage the liver. Number 4, soft drinks. That is the also biggest problem. There's so many you can go on that one. The food which one they're using water, we've seen so many videos, we've seen many things. They're not cleaning their hand properly. They're not doing the water. We don't know what kind of water they use. So many people on the street, they pani puri, ye puri, they're making that one. They're drinking lot wrong water and using their hands. They should be the check of that one should be cleansing. Should be the not do like that way. Before was we eating our food from homemade. Our mother, our sister, wife made the food. That is the clean always. Not, you know, that only in India, when our Sanskriti, they call jute. We don't have to eat each other the share. We have our own food. We eat it, we finish it. Nowadays, many people, they're eating together from one plate. Small saliva can make in your body hepatitis system. Nowadays, according to World Health Organization, nearly 10 to 15% people are hepatitic, which were diagnosed, different type of hepatitis. And we don't know how many hidden, because no one want to check up their blood. And many other problem is many medicines people eating from the hospital, from anything, they have a lot of side effects that they make the liver bad, damage the liver. They're written already. I'm not saying that it's anything personally. I'm not personally saying, but those kind of medication, they're making our liver weak, liver damage, kidney damage, metabolic damage. Then liver have the lot of pressure on the liver. Liver has one limit. Liver need good food. Liver need good water. If you don't give the good food to liver, what can do it? Liver can't throw. Liver is very honest. I call Bhandari, who giving all the nutrition to all our organs and hormones go from there. If the other organs become slow down, liver also becomes slow down. And liver only can keep the toxins 50-60%. After 50-60%, the 50-60%, the things which one is not good for the body, they start throwing in the toxins, throwing in our body. That go to every organ, and other organ become damaged. Then they become slow down. Liver can't give the good blood to them. Then lot of problems come. All the health problems, according to Ayurveda, we treat the liver first. We look after the liver first. Our system, they say, check the liver. Why skin problems come? We check the liver. Why memory going down? Check the metabolism go down. Even Ayurveda, in the what do you say, in the diabetes, it's not the, in Ayurveda say diabetes not the problem from anything. Liver is biggest problem with the diabetes. Pancreas rely on the liver health. If liver is good, pancreas never come down. When I treat the people who have the diabetes, I look after the liver. These kind of things we need to be find out. We need to be educate our listener, our person. That's the reason so many last 30 years, as you said, 40 years, the start problem. If we avoid these kind of food, if we avoid the alcohol, if we avoid the fizzy drinks, if we avoid the 10 food, I always tell my patients, avoid these things if you want to live a healthy life. If they don't avoid, no one can save them. This is the biggest reason. And also one more reason, the water now have a lot of metals inside. Many problems also come when they're filling the teeth. They usually fill with the mercury. The people also they can damage the liver. So this is the reason why people from 30-40 years getting liver problems. But with the Ayurveda, if we do the cleansing of the, that is the reason I design. I told before, my mother died with the cancer. So after that one, I find out how can we remove that one. Then in my experience come, those kind of the toxin in our body coming from the food, coming from the water, coming from anywhere, we can clean. We need to be clean at least our body. I think everyone nowadays, if they want to healthy life, should after 6 months, they do one cleansing. If they are There are so many in Ayurveda cleansing system. We have the Panchakarma cleansing system. We have, I designed Saptakarma cleansing system for the full body. This was named the Sarvaroga. My father's, when I give this, design this one, my father start using that one. They were Vaidya, Gurukul their own. And they when I give them before, they say, this is they call Sarvaroga cleansing. It's a full body cleansing we need. When we do the full body cleansing, then liver can become the active again. We need this kind of now. Before was no need. Before Ayurveda say once a year you have to clean. If you feel any difficulty, you have to go to the cleansing system. That is the marvelous system, Panchakarma system. That is our Acharya designed that one, take the toxin out. But now our toxin is spreading everywhere because of blood circulating everywhere. They bring the toxin again. You need to be full body cleansing. That one it can save the liver, save the other organ, and become the body working again. They take all the toxins. Still, nature made our body and liver very powerful. They can cure inside system if good physician you find.
Thank you. Thank you very much, sir. Now I would like to invite questions from the audience. Abdul Batsanji is there, Aishwarya ji, Anita ji, Ilaji, Mandeep. If anybody would like to ask any question regarding liver disorder, welcome. Please unmute your mic and ask the question.
I think not unmute. Yeah.
So they are preparing themselves to ask the question. In the meantime, sir, I would
Yes,
like to ask the main prevention. What is the prevention? How we can prevent ourselves? Because there is no such gown that we can wear and we can be safe from chemicals, radiations, technology, harmful effect of technology. So what is the way out, sir?
this is billionaire question. In everybody's mind, that one. Not mind. This is our choice. We have to live in this world. We have to live, we have to protect ourselves. That is the that question you ask. As I told few minutes ago, everybody should take the blood checkup at least once a year and keep eyes on their organs and nutritions. Nowadays, very easy. There is something, Kudrat is very great. They always do something, some people doing the wrong thing. There's also nature creates somebody, bring something, bring the new thing. Nowadays, blood check report, I think, is the best thing allopathy introduced. All the body's organ we can see working or not. I designed one blood check report. I can send you, you can spread everywhere. That one, my patients, I tell them I need this one, any chronic. That's very helpful. If everybody do that blood check, and you can see the whole body is, you can see. Unnecessary, don't take any vitamins, any vitamin B12, this thing, that thing, iron, multivitamin. Don't take it, please. If you feel tired, if you feel like you are not feeling well, go to some professional. Not very costly. Otherwise, if you delay, then it costs you more. And eat good food. Avoid any street foods. Home cooked food is best for who especially suffering from these kind of things. If the people want to stay healthy, they also avoid that one. Because I'm not against them, but what can we do it? But they're not giving the good thing. Why not they honestly make everything? They can charge more, but they don't bother. They're doing the business. I'm not bothered their business. I'm Ayurveda physician and I'm worried about the public. Human body is most important than small business to support them. We love them. They can, if they do the proper job. Many people nowadays who say so many oil, they're using so many oil companies, they're making the rubbish oil. That is also affecting our liver. Liver have limit, bhai. More than that one toxin, he can't carry the toxin. That is the only prevention. We have to be once a checkup and eat good food, good water. They can do the alkaline waters. If they don't have anything, just put it every day, one piece of ginger, some kind of the curry pata, some kind of bay leaf inside. What they find, they can put it inside. They got some tulsi, that one, boil it, keep it, drink that water. They also protect from that one. Tulsi is Maha Aushadhi in Ayurveda. If they drink that one, drink the green tea sometime, okay? But don't drink anything. Milk is also not pure. We can't find any dairy products we eating outside. What do you think you can afford? And secondly, so many medication, you have to think about what they're selling. You can afford at home? No. Person have, all the public should have start using their own brain. If they're cheap, means something wrong there. And don't take so much of food. Don't fresh food, eat fresh food, make it, then you can protect the liver. It's nothing wrong, it doesn't matter. Our liver, our body is very intelligent system. So this is my advice to prevention of that one, liver or any organ. Whole system we have to prevent, not only liver. We can look after our body. That is the way only.
Sir, one question from audience has come.
Yes.
What are the Satkarmas?
What did you say?
Satkarma.
Saptkarma, I say. We have the Sapadhatu. Saptamain Ashyas. That is when our body, whole body starts gone to the liver, our toxin. Liver spread everywhere that toxin. He can't clean everything. Then is in our body, when they spread there's only Saptkarma. We can detoxify the body. Panchkarma, you know very well. We know they have some areas. When that Panchkarma was designed, those time, like you say, from 30, 40 years, everybody become the problem. Liver become more damaged. That time, liver was not damaged easily. That time, colon and our stomach, with a clean body, start working. Now, if they go to other area, with Panchkarma, we can't clean. And Saptkarma, what I designed, Sarvaroga Saptkarma cleansing, that one, you can give to anybody. Second, we have the difficulty. Panchkarma, we can't give to anybody. If the liver cirrhosis have the big problem, hepatitis big problem, they are very weak patients, you can't give them Panchkarma. In the vomiting, the woman is very difficult. Anemia is very difficult. Basti is quite difficult to that one. What I design is they go up to make the gut problem solved, digestion solved, that one, okay, metabolism strong. Then that medication take few days, start going to liver. Until liver is not detoxified, that is for the medication what I design as a surgeon, go to the liver and start liver detoxifying. Once liver is detoxifying, then other area can be detoxified, because only blood can reach our brain, blood can reach our heart, blood can reach our kidney, blood can reach in other organs, lungs. These organ is very important to detoxify again. Skin, we can't do anything without the reach the blood properly there. We have 7 scale of lid. The Saptkarma, that is, we call the name, the Saptasya, Saptkarma, Sapdhatu, all they clean. Only blood can reach there. That is an I give the name Saptkarma to you in anywhere in the body. That medication can go. Only one source we have, the blood. That is very mild and very strong, and not give that difficulty to any, no need woman, no need virgin. But they clean through the urine and also through the malasya. It's the like I gave this one 99 plus year old people. I gave this one our Param Mitter, their grandson, we gave the 18-month-old that one, in my experience. And any stage of the cancer, I give this one. We have the 3 type of Saptkarma cleansing. We have to design custom made. What kind of body system, what kind of strength, prakriti of the person, what is the stage of the problem. If we design that one, it's not difficulty. Every Ayurveda practitioner can learn that one. It's very not difficult. When they know the Vata, Pitta, Kapha system of the body, everybody can use it. I designed that one. They're working very well, Pavanji. All my results coming, the reason of my Saptkarma. That is my father, when they say, Beta, this is a Saptkarma, not only Saptkarma, this is Sarvaroga cleansing. Any design, what he said, any problem you can't even understand, just give to them. This kind of this one, I try to, thanks very much. You asked me this question, is very valuable. I'm telling the always Ayurveda practitioners, we need nowadays like this medication, this system. We can't rely on the 3004. That is great. We still follow that one. We have to some modification now. You can't change the rules of Vata, Pitta, Kapha. You can't change the Ayurveda rules. They done 5, sometimes surprised how they know the 5,000 years ago. What is our system? So this is the only way to protect ourselves nowadays from these kind of toxins. So when these kind of toxins remove from the body's organs start working. Our system is, as I say, autoimmune diseases. There's not any autoimmune diseases. Actually, our system starts struggling inside. They shut down. When they shut down, other organs start suffering. That is in allopathy, they call autoimmune diseases. The body stop protecting ourselves. Why? Because system is not working. Liver is not functioning properly. Metabolism is not functioning properly. Gut is not functioning properly. Other organs rely on these 3 things. And that one, Saptkarma cleansing, make them again active, clean all the toxin from there. Doesn't matter any type of toxin. That is I say custom made. If they have the lot of inside of minerals, I seen the people taking the over vitamin D, vitamin B, that one, so many multivitamins, they become inside the store in the body. And with this one, they can become down. So this is the new type of the cleansing system we have to introduce. The Panchakarma, if they're normal person, is perfect for that one. When they come the stage 3 or 4 or last stage of the cancer or any disease, they need this kind of, because Panchakarma we can't apply on that one, that stage. This is I try to everywhere. Thanks so very much. You asked me the question about the Saptkarma today. Dr. Neha Sharma ji wrote very good article on that one. And so many people used here. They know what the Dr. Joshi with me. So many cases we see together. Dr. Joshi know we're using that one, and the results start coming within the first week. That is, and I say, if we want to give results like I said,
Doctor, actually, I want to ask some question, sir.
she can ask.
Hello, Dr. Avtar. How are you?
I'm okay, darling. You?
I'm very well. Yes, so
It's
for
good.
my question for you will be, what is the long-term strategy for preventing relapse of, the liver conditions through Ayurveda? Just give me the long-term strategy.
Long-term study, I told you, the simple theory, do check up your 6 month or 1 year. If have any problems, simple, very simple way. No, not complicated. No need any doctor to check a blood. You can see what the report is come. Everybody is now is educated. You can go and Google check it. What is the if they're not balanced, our body, Ayurveda, what I am doing, what Ayurveda teaching, do the body balance. We say Vata, Pitta, Kapha, we have to make them balance. That is, if they increase something, we bring them on the normal. Ayurveda, thousands of years ago, teach us one lesson, Vata, Pitta, Kapha. This is the three things run the body. Not on the body, any machinery in the world, they run on the three things. So if you do the blood check after 6 months, or when you feel not well, 1 week or 2 weeks, straightway before you go to the doctor, check up your blood check. Don't delay. If these problems are not big. You was in the UK, we done so many my programs with Dr. Honzi, and you know that one. And this is the my advice, my prayer to everyone: stay healthy. You don't need any doctor if you check up your system, if you look after your system. Only that way, because you can't stop the pesticide, you can't stop the polluted air, you can't stop the polluted water. It's not in no one's hand, this one now. But you can decide what kind of food you eat, no? You can decide which kind of air you need. If you think air is nowhere, you put the mask. Or do some yoga exercise to every day detoxify your lungs. There's so many in the yoga exercise. I designed myself one. It was working very well on the. Maybe she come there to her partner, and the lungs was very bad in my website. They can see that one. They say, what do you decide that kind of? I said, in our body, carbon dioxide, when it's stop in the lungs, that's also become the problem. So small things, we can help our body. Few things we do, we can keep healthy ourselves. That's very important. Okay?
Okay, perfect. Thank you.
Anything you want to more ask?
Just like maybe probably if you can just give us more approaches towards the autoimmune liver diseases or alcoholic liver diseases.
There's so many type of liver, as I told you. If the alcohol related, stop the alcohol. If they can't stop, need the help from somebody. The diet is most important. Only liver, our liver is work for the diet. Otherwise, liver have no any job. What we eating, it make the nutrition, it make the blood good, make the supply all the nutritions and minerals to the whole body. This is like in Ayurveda say, this is like a bhandari. Bhandari means who doing the cooking for you every day, like a mother of the body. What food you give to your mother, she cook it spread to the children. All organs are related to them. They rely on that food. So we have to give very good food to our liver, our stomach, our digestion system. Keep well that gut problems. If have any problem, if we look out, liver not come straight away. All the liver problems people have the gut problem first. Without gut problems, liver never go wrong. Because undigested food, unnutritious food we eat, they make the liver toxified. There's not only one organ, they're related to each other. Organs, after the liver, all the organs rely on the liver. Organs rely on our gut problem, metabolism problem. They're very big chain. We have to look after the whole chain. Cook good food. Okay, you start cooking there some food. Good girl. Thank you very much. You want to
Well,
ask more? You can ask more.
yes, just my last question for you will be, since you were like earlier talking about the detox. So like what precautions do you think that must be taken before like we administering the detox therapies to, especially to the liver patients?
Yeah, this is also physician should decide what is the stage of the liver problem. That reason I say don't do yourself, because need qualified person. Qualified person can save you. Self-diagnose, self-medication people, they're damaging. That's also one reason. Lot of people, there's millions, billions of doctors nowadays, but people are still sick. Why? Most of people, when they go to any physician, they too late that time. They done everything damage more. Maybe 5% damage. When they reach to the physician, Ayurveda physician, they was 80% damaged, their organs. Don't do this one. This is the biggest also problem. Why so many? There's every kind of the therapies nowadays. I say most of the time, if some physician not give you the result, doesn't matter any therapy. I'm challenged that one. I say, I say this one. If any doctor, you are right to get the result within 2 weeks, doesn't matter on any stage. Like I said, even a cancer patient, chronic disease patient, if you can't get any benefit within 2 to 4 weeks, go somewhere else. Doctors, I give the message to all the doctors today. This is we have to do. If you can't, we don't know the job, don't do that job. Everybody is not the perfect on every organs. You have to find the good doctor. First thing you have if you give the report, if he can't tell you 50% your problem internal, no need to tell him. Ayurveda physicians are very skilled. They can check the pulse and tell you. If they check your pulse and check your report and tell you, okay, so and so you have the problem, you have the symptom, this one, then he can do or she can do your treatment. If they don't tell you, okay, we try this one. No. First, you have to be, first lesson for all the public, I tell them, go to any physician, you choose it, doesn't matter allopathy and Ayurveda or any homeopathy, they're all perfect. I salute to everybody what they're doing. But if they don't tell you what is actually your problem, what is root cause of your problem, he can't cure. Doesn't matter who is that one. If he tell you, he can cure. If even 50% if he tell, he can do. If they can't do it, just move from there, find a good practitioner.
1 or 2 questions as time is over.
Yes, sir.
So if anybody would like to ask anything, any question, any query in the mind regarding liver disorders, welcome. Last 2 questions. Any question is there? Aishwarya ji, Abdul ji, Amita ji. I have sent you my details, Aishwarya ji.
Yes, please. Thank you. Thank you so much. I'm done with my
I was
questions.
Vice President of Imami Jhandu, and now after retirement, I am Professor and Head of the Department, Rasashastra in Bhopal.
That's lovely to hear from you.
Yes, we will be in touch. So any question from any? Yes. somebody would like to
Dr.
ask.
Avtar is just one call away, so I'm fine with questions for today.
Right.
Thank you.
Thank you very much.
I would like to request Professor Lakshmikant Dwivedi sir, legend Rasastri from National Institute of Ayurveda, Jamnagar, and now in Anand, for his concluding remarks. Professor Lakshmikant Dwivedi sir.
नमस्कार सभी विद्वानों को
नमस्कार
और
सर.
अवतार सिंह जी को भी नमस्कार। काफी अच्छा चर्चा रही यकृत के लिए और हम लोग तो खैर कामला और यकृतोत्तर के नाम से सारी बात करते हैं और ये सारे जांच वगैरह और ये उस समय नहीं थी जब एंशिएंट टाइम में नाड़ी पकड़ के और निदान करते थे। सीधा है कि भूख लगती है या नहीं लगती है, वहीं से पकड़ में आ जाता है। तो लीवर का फंक्शन गड़बड़ होते ही सबसे पहले भूख खराब होगी और भूख नहीं लगेगी, उस पे खाया तो फिर सारा लोड लीवर पे ही पड़ना है। तो मेरी समझ तो इतनी है कि जीवन में मुझे भी 2 बार जॉइंडिस हुआ। ये वायरस कौन सा था ये ढूंढने की हमने जरूरत नहीं करी, किंतु आयुर्वेदिक दवा से ठीक है और अपना काम जो है चल रहा है। कहीं ऐसा नहीं है कि कोई तकलीफ हो। समय पे भूख लगना चाहिए, ढंग से नींद आनी चाहिए, 2 चीज सबसे बड़ी है। और साथ में जो निदान परिवर्जन वाली बात है, जो आपने काफी सारे आधुनिक निदान बताए, उसके ऊपर जरूर पब्लिक को ध्यान देना चाहिए। इसी के साथ में मैं अपनी वाणी को विराम दूंगा। धन्यवाद सर। थैंक यू सर।
थैंक यू वेरी मच सर। आज समय चेंज हो गया है और नए नए रोग आ गए हैं, नई नई उपलब्धियां आई, नए नए रोग भी आए। तो आपने बहुत अच्छा किया, बहुत अच्छा बताया। ये बिल्कुल मेन साइन है, भूख ना लगना और नींद ना आना, टायर्डनेस हो जाना, टांगे टायर्डनेस हो जाना, घुटनों से नीचे बैक के में दर्द होना। तो बहुत थैंक यू आपका, बहुत शुक्रिया आपका।